Hi, I'm Sharon Krispinsky. I'm a registered nurse and chronic health program coordinator for Lee Health Solutions, a department of Lee Health. Today, I'd like to talk to you about active self-management of your health. What exactly does that mean? Before we get started though, let me discuss with you the difference between acute and chronic health conditions. With acute conditions, they generally have a very sudden onset that prompts us to go see our physician, where they do a thorough evaluation and then they prescribe a treatment. Once we follow that treatment, we generally start feeling better within a matter of a few days or weeks. Examples of acute health conditions would be like an ear infection or sinus infection, appendicitis, labor pain, to name a few. Chronic health conditions are very different though. Chronic health conditions generally don't have a sudden onset. You may have this condition for months or years before seeking physician treatment. The treatment for a chronic health condition is often uncertain. The doctor may try a variety of different treatments to see what works well for you for managing that condition. And you often have chronic health conditions for years and often a lifetime. Examples of chronic health conditions are type 2 diabetes, heart disease, arthritis, depression, to name a few. The World Health Organization states that 80% of type 2 diabetes, heart disease, and strokes can be prevented, as well as 40% of cancer, by adopting a healthier lifestyle. What exactly is a healthier lifestyle? Well, it's eating healthy, incorporate physical activity into our daily routine. If you smoke, stop smoking, as well as other factors such as getting a good night's sleep, stress management, to name a few. So let's talk about nutrition, some general healthy nutrition principles. We as a society generally do not eat enough fruits and vegetables. It's estimated that we eat 5 to 7 servings of fruits and vegetables a day. Now you may ask yourself, well, what is a serving size? Well, serving size is generally a half a cup cooked, 1 cup raw vegetables, or for fruit about the size of my fist. We want to choose foods that are low in fat. We want to eat more plant proteins, which you can find in beans and legumes and vegetables. We want to eat more wild-caught fish and other lean protein sources. When we read food labels, we want to choose foods that have less than 5 grams of total fat, and we want to choose unsaturated fats, which are generally liquid at room temperature, like olive oil. We want to reduce foods that raise cholesterol. Cholesterol is found in animal products, such as meat and dairy, so we want to eat less meat and dairy if we want to lower our cholesterol. And we also want to avoid saturated and trans fats. When we choose carbohydrates, we want to choose products that have whole wheat and whole grain products, brown rice, and more vegetables and fruits. We want to decrease the sodium, so we don't want to add salt to our foods, and we want to eat less processed foods. Processed foods are foods that are generally found in a box. We want to eat more foods with just one ingredient, like a piece of fruit or vegetables. And we want to maintain a healthy weight. Research has shown time and time again that if you can just lose 5 to 7% of your body weight, you could reduce many chronic health conditions or prevent chronic health conditions from even occurring. So let's talk about exercise. Before we talk about the specifics of physical activity, this is very important. If you are not physically active, you have to get medical clearance, see your physician to get approval or clearance to begin an exercise program. But once you have medical clearance, it's important to start to be more physically active. To make up a comprehensive physical activity program, there's actually 4 types of physical activity that we need to be thinking of. The first is flexibility exercises, and our goal is 10 minutes of flexibility exercises without stopping. You might want to consider yoga and Tai Chi as good forms of physical exercise for flexibility. Strengthening exercises. We like to reach a goal of 8 to 10 strengthening exercises 2 to 3 times a week. Some good strengthening choices would be, to consider light dumbbells, soup cans, resistance bands, or Pilates. When we talk about endurance or aerobic exercise, the goal is 150 minutes of moderate physical activity a week. Now that can sound daunting, but you can break this up. You could do 30 minutes of physical activity 5 days a week. You could do 2 15-minute exercise periods a day, 5 days a week. You could do 3 10-minute exercise periods or 6 5-minute exercise periods a day. The important thing is that you're moving and you're not sedentary. And finally, I'd like to talk to you about balance exercises. As we get older, we're more at risk for falls. So you might want to consider Tai Chi or asking your provider or physical therapist for a variety of balance exercises that you could be doing. If you do smoke, I would encourage you to talk to your provider, have that conversation, because there are different opportunities and different smoke cessation programs that your provider could steer you towards so that you can stop smoking. Now, when we have a chronic health condition, we have a choice to make. And that choice is, are we going to be active self-managers of our condition or passive self-managers? And we probably know both active managers and passive managers of individuals that we know in our lives. So what's an active self-manager? Well, an active self-manager is someone that despite having a chronic health or pain condition, they're still engaged in life. They're going out socializing with friends and family. They're physically active. They're eating healthy. They're seeking out information on their condition, and they're enjoying their life to its fullest. A passive self-manager is the exact opposite. Those are individuals that you might know that they're not engaged in life. They prefer to stay at home. They don't socialize. They're not eating healthy. They're not physically active. And as a result, they become more disabled. So we hope that you choose to become active self-managers of your health. And at Lee Health, we have a couple workshops that are designed to teach you to become more active managers of your health. We have workshops that were originally developed at Stanford University. They're taught worldwide. They're absolutely free, complimentary, and we meet once a week for 6 weeks, and we teach you a variety of tools so you can become active self-managers. So besides physical activity and nutrition, we talk about such things as how to get a good night's sleep, how to make good decisions about your health. We talk about action planning, which is a very important tool, which is a tool where we have you write down goals that you're going to work on for the coming week that's going to improve some aspect of your life. We teach you communication skills and mindfulness and weight management. And we talk about medication as a tool, but we want you to realize that medication is just one tool to actively manage that condition. There's so many others that you can be utilizing. And we talk about working more effectively with healthcare professionals. So if you'd like to become an active self-manager of your health and you want more information on how to do that, I would encourage you to call us at 239-343-9265. Again, it's 239-343-9265. And you can register for one of our upcoming workshops. Because of COVID-19, the workshops are now virtual, but we look forward to seeing you in the near future at one of the workshops. Thank you very much.